of you. I'm delighted and gratified to welcome all of you to the live interview corresponding with the International Conference for Quality Education 2024. This conference will be held on January 20th to 24th, 2024 in the most happening city, Mumbai. This conference will give a rewarding opportunity to meet global leaders, personalities, inspirations from the educational field, which will give us an amazing opportunity to cement a solid platform where we can invite and welcome positive changes and in education and implement them with success. The main objective of the conference is to emphasize on the empowering, equip, and permit the 21st century skills and uplift and boost and elevate the spiritual well-being in children by escalating, strengthening education quality by giving most important consideration to STEAM, education, employability, entrepreneurship, greening education, and mindfulness. To establish and build such an atmosphere of the upcoming conference, we'll be conducting live interview series with experts from the industry. This is Shehwar Sohail, talk show host of the International Association of Quality Education, senior lecturer and head of Early Childhood Department from Amazon College, Bambalapiti, Colombo, Sri Lanka, joining with you today for this amazing interactive talk series. Now, coming to the main event of today, I take much pride and honor to welcome this eminent personality who is a doctor by profession and also the principal and owner of Mighty Minds Kindergarten. Dr. Hirudi Mawilmada was born in Colombo, Sri Lanka, was a former national swimmer in Sri Lanka, and after completing secondary education in Wellington International School, Dubai, and Colombo International School, Sri Lanka, she has obtained a bachelor's degree, Doctor of Dental Medicine at the Gulf Medical University, UAE. After completing her medical studies successfully, she moved back to Sri Lanka, carrying the prestigious qualification and to pursue the dental career. Before applying for the dental license exams in Sri Lanka, she has got the opportunity to observe and assist in a reputed hospital in Colombo for 1.5 years. While she was there, she began to do masters in business administration at the University of Bedfordshire, UK, and also Dr. Hirudi got a golden opportunity to work at Ninewells Hospital to experience the medical administration field. During the COVID outbreak in 2020, Dr. Hirudi got an opportunity for a shift in her career, where she was asked by her mother to assist her in the preschool in an online platform. This temporary shift proved to be a perfect starting point for a change in her career. And already, Dr. Hirudi had this passion of enthusiasm about learning and seeking out new experiences. She successfully completed a diploma in early childhood education and volunteered at Mighty Minds Kindergarten, and this added experience where she was able to adopt creative approaches to help children develop. The professional background and experiences she acquired have greatly supported her in providing the children in the community with outstanding early childhood education. Dr. Hirudi, your qualification, expertise, and commitment are spellbound, breathtaking, and the journey itself is a motivation to all of us. Thank you for your deep felt contribution to the society. So, Dr. Hirudi, the time has come to extend a warm welcome to you. Welcome, Dr. Hirudi, to this interview series.
Thank you, Mr. Harry, for the lovely introduction.
We have a hot topic for discussion today, and it is about dental health awareness. And the target group is the children. Generally, dental health is a state of the mouth, teeth, and orofacial structures that enables individuals to perform essential functions such as eating, breathing, and speaking. And when it comes to psychosocial dimension, it is a self-confidence, well-being, and the ability to socialize and work without pain and discomfort. So, Dr. Hirudi, when it comes to the child's concern, is oral health important?
Yes, it's definitely important. Dental health is very important because it affects the child's overall health. It also impacts the development and growth of the children in several ways. Child could have poor breathing. Sometimes, speaking skills also decreases, appearance of the smile, and adapting to social situations. Now, when we talk about appearance of the smile, for example, let's say a child is in the preschool and the child has black teeth or like cavities. So when you smile, there is a bad impression. Some kids do look at the appearance too. So there are so many kids who bully. So when that happens, that child will be neglected or they'll be mentally down. So it's the parents should be advised in keeping the child's dental health in good condition, because if that the appearance of the smile is affected, the child's whole growth and also even uh, the goal of learning is also decreased. So because of that, it's very important to keep your oral hygiene in good condition. Sometimes, if you have cavities, the child may have pain and also discomfort. Then there's an embarrassment, low self-esteem, and inability to perform activities in daily life. So when this happens, the child's cognitive development also decreases, because when a child is having pain, sometimes they don't want to go to school. So when that happens, they miss a lot of work and they won't be able to do any activities. They'll be demotivated. So all these factors do affect their growth and also development. It is important to look after your child's teeth from the moment they start teething. That means from the moment that they get teeth, you have to look after it. So keeping your child's teeth and gums clean will protect against infections, cavities, and pain. Because if you get decayed baby teeth, that can damage the permanent teeth. Permanent teeth means adult teeth. So definitely, it is important that you take care of your teeth from the beginning.
Thank you, Dr. Randu. So that explains that if oral health is good, child's overall health is positive.
Yes.
So let's move to the next question. As it's an open fact, children love sweets and cannot keep their hands off it. Pertaining to this statement, what are dental caries or cavities? And are kids at high risk of getting cavities?
Okay, so let me explain what a cavity means. Basically, there are holes that form in your teeth. So tooth decay occurs when there's bacteria in your mouth that breaks down the sugar from food and drinks, and that produces acid. So that acid only damages the tooth surface. The tooth surface is called the enamel. We call it enamel, but for you, it's easier to understand if we say the tooth surface. Then the enamel causing it to dissolve and form holes. So basically that's the acid will cause the holes. Holes means it's either dental caries or cavities. Use two different terms, so easy for kids to understand. When we are explaining it to kids, we can say, the hole can form if we eat sweets. So if we talk about the symptoms of tooth decay in child, sometimes parents can identify at home, but sometimes you can't because it differs from child to child. So during the first stage, the tooth loses minerals that we call demineralization, which shows as white spots, right? So when that white spot comes, we can identify there is something wrong. This is when the teeth decay has damaged the tooth enamel, but has not reached the dentin, which means it has not reached inside of the tooth. So we can do some early identification and fix it before it becomes worse. So demineralization, when that occurs, you get sensitive teeth. That's why sometimes when you eat sweets, you get like a sensitivity. Sometimes that is the reason when you have demineralized teeth. Then when the early cavity appears on tooth, it has a light brown color. Then when the cavity becomes deep, at that time, you can see darker shade of brown or black. That's when you can see a cavity. But sometimes even those black dots are not really cavities, because if it's, we usually probe it and check if it's soft. When it's soft only, we know that it's a cavity. But if it's hard, it's not. It's just a black spot. It could be asymptomatic. So the symptoms of tooth decay and cavities vary from child to child. So cavities don't always cause symptoms. Sometimes children don't know they have one until you go to the dentist and find out. So another question that we get asked is, how is tooth decay treated in a child? Some parents are quite concerned with the procedure. So treatment will depend on your child's symptom, age, and also general health. It will also depend on how severe the condition is. Sometimes it could be like a surface cavity, or it could be a deep one. So the procedure depends. In most cases, most preschool kids get small cavities. In that case, the treatment requires removing the decayed part, which is the black color hole, and replacing it with a filling. So fillings are material placed in the teeth to repair the damage caused by the tooth. That is also called a restoration. So we use it as a restoration or filling. So cavities are quite common in preschool kids. So it's always better to take your child to dentist early as possible if you identify this.
So this explains definitely kids are at high risk. And
Yes,
I think so change of their snack eating pattern and
yes,
feeding on sugary fluids other than water is a must.
yes.
Okay, so moving on to our next segment of question. I think many of the parents have the thinking that caring and maintaining of the milk teeth is not important since it falls out. So does cavities in childhood affect adult teeth? And uh, and how can this be addressed?
Right. So a lot of parents think, the cavities in baby tooth doesn't matter because they'll be lost anyways. But that's not true, because dental decay in baby teeth can negatively affect the permanent teeth and lead to a future dental problems, because when you grow up, that baby teeth decay tooth can affect. Healthy baby teeth safeguards your child's future adult smile. So it's always better to check your child's teeth and make sure that there is no cavity. So if there are problems with baby teeth, for example, now let's say a child will have a chronic tooth decay or premature loss of baby teeth from untreated cavities. So when you don't treat cavities, it can fall out. Then that can cause adult teeth to develop decay and even erupt crooked or misalignment. So let's say you let the child's teeth just fall off with cavities. Then the adult tooth that is going to come out can come crooked. So that is when you need orthodontic treatments later on in life. Then you have to go to so many dentists and put braces. That takes a long time, and that is a hassle for parents also. So why do you want to go through that when you can prevent it at an early age? So baby teeth, or we call it milk teeth, also create space so that the permanent teeth can come in as the children age. So if kids have dental problems, they may have trouble chewing also. That can make mealtime difficult. That's when sometimes children are crying all the time, but parent doesn't know why they're not eating. So it could be a dental problem. So yes, it definitely affects adult teeth. That you have to keep in mind.
Thank you, Dr. Hirudi. So this explains that foundation needs to be strong. We need to take care of the teeth from their babyhood. Then later in the adult stage, their teeth will be strong. Coming to the next question, as I have heard, many diseases are contagious and can spread to another person. Can cavities spread from one person to another? If you could elaborate on that.
Right. So I want to actually elaborate more on this, because a lot of people think that it's not a spreadable disease. It's not actually a disease, but when you think of it, it's a bacteria that causes cavities, right? And this bacteria is called Streptococcus mutans. It is very extremely contagious. So that is why we say, you have to keep either the toothbrush away from the child, like separate it. If the parent is having a cavity, and if that bacteria is in the toothbrush, and if you keep it near your child's teeth, child's toothbrush, it can transmit. So that is why it's always better to have separate places to keep your toothbrush. It can also be transmitted to saliva, which means cavity can indeed be contagious. So bacteria spread when people share food, or when young children put objects in their mouth. Even in preschool, a lot of children I see, they put toys in their mouth. And then when they leave it, another child can take it and put it in their mouth. So saliva to saliva, then it can spread. And another advice I can give is, don't let your kids share water bottles. Sometimes kids, they don't know, they just for fun, they just drink and can share the same straw. So we don't know if the child is having any dental problems. We won't know, because when they're in the preschool, they can do many things. So we have to educate teachers also not to share these water bottles. And also lunch. That of course, if you're sharing, if we are providing or if we are serving it to them, that's okay. But let's say the child is using a fork to eat their food, and then again put the fork into the other the child's lunchbox. Then again it spreads. So you have to educate the teachers and parents not to do that. So it is an important factor, and always keep a reminder. Don't keep the toothbrush together when you're at home also.
So thank you, Dr. Hirudi. That confirms my question to you that the responsible bacteria behind the spread is Streptococcus. Am I right?
Streptococcus
mutans.
Yes.
Right. And care needs to be taken when children tend to share water bottles, lunch, and especially point to be noted is not sharing the toothbrushes.
Yes.
So the next question I would like to ask is, let me just talk about this fluoride. So fluoride is an important element which can inhibit or reverse the initiation and progression of dental caries or tooth decay, and can even stimulate newborn formation. So will you be able to explain us more on what is this fluoride, and why is it in toothpaste we use? And another question is, now since we as adults use fluoride toothpaste, can babies or infants can also use this fluoride toothpaste?
Yes, this is also mostly common asked question by parents. So basically, what is fluoride? It's a natural occurring mineral. It is in toothpaste, drinking water, and some foods. It makes teeth more resistant to acid and other compounds that promote tooth decay. So fluoride resists acid and other compounds. And fluoride helps to reduce the risk of cavities, which we all know by now that it is a major dental issue for the children, and has shown to reverse signs of early tooth decay. So you can reverse if you use fluoride toothpaste. And the most asked question is, can kids use fluoride toothpaste? An overload of fluoride could cause a condition called dental fluorosis. So you should not use anything in excess. So dental fluorosis, what it does is it alters the appearance and the color of tooth enamel. Tooth enamel means the surface of the tooth. It alters the color, and also the appearance also can change. And also fluoride ingested in large amounts can lead to dangerous toxicity. It is quite toxic if you use it in large amount. And swallowing a small amount of toothpaste is okay because it's generally considered safe. So ADA, which means American Dental Association, recommends not to use fluoride toothpaste for babies up to 1 year, because they don't know how to brush their teeth and they can swallow for fun. When there's like white bubbles, they can just drink it with water. So it is not safe for babies to use fluoride toothpaste. Now, usually teething starts between 3 to 12 months. So if there's no teeth, you don't have to brush your teeth. You can use a damp cloth to just wipe your gums. That is enough. So I'll give you like a category where you should use fluoride and where you should not. So children from 0 to 18 months, that's when you use only water, no toothpaste. Then from 18 months until the child is 6, use a small pea-sized amount of low fluoride children's toothpaste. Now you can either check the toothpaste packet, you can see the amount of fluoride. Usually for children, it's around 1000 ppm. So if you want, you can check that, but usually kids toothpaste, when you see kids toothpaste, that is correct. They have put the correct amount, so you can take that. Then from 6 years onwards, you can use the usual pea-sized amount of standard fluoride toothpaste. Usually in standard toothpaste, there's about 1350 to 1500 ppm of fluoride. So that is the category where you should use fluoride. So make sure that babies don't use fluoride toothpaste because it's not that safe.
So it is confirmed by, I think you said ADA, right?
Yes,
So as
American
they
Dental
recommend,
Association.
yes. So as they recommend not to use toothpaste with fluoride and toothpaste alone for babies below 1 year. This explanation really helps. Thank you so much. So if we can move on to our next question. So as we know that there are many types of toothbrushes available in the market. And if I'm definitely sure, most of us still are unaware of the correct product to use. And there are now, I have seen electric ones also available. So doctor, if you could tell us what type of toothbrush is the best?
So if you're using a manual toothbrush, you can end up losing teeth. That I don't think many knew. Because
Yes.
even we also didn't know a long time back, but now the technology, because of technology advancement, and we have to get updated with new technology. So if you use manual toothbrush, it can you can overbrush, which means you can put a lot of pressure when you're brushing your teeth. This can lead to gum recession. Gum recession means your gums can wear off because you're not brushing very hard. Then if you get gum recession, it's very difficult to treat also. And it causes sensitive teeth and also you get decay and it also falls off. So this is why it's very important that you brush correctly and use the correct brush. So if you think about what brush is good, I would prefer if you use an electric toothbrush because some now they have electric toothbrushes which has a pressure sensor also. So that is best so that you will know how much pressure you're putting. Sometimes when you put too much pressure, the sensor will stop you. So you know that you're putting too much pressure. And it also has a timer, which will make it easier for you to brush. Usually you have to brush for 2 minutes. If you divide the upper joint to 2 and lower joint to 2, so 30 seconds each. So clockwise you can do, or the other way, it doesn't matter. As long as you do 30 seconds of each, total of 2 minutes. If you can brush, that's good. So I would recommend using electric toothbrush.
So is this electric toothbrush freely available in the market?
Yes, there are a lot of toothbrushes, but the pressure sensor one, it is not available. You can get it from abroad if it's possible. But even if it's just a normal electric toothbrush, you can use it because it's not giving a lot of pressure. You should not press it too hard. So if you keep it lightly, it's more than enough.
So any brand do you recommend, doctor?
I don't want to recommend any brand because usually there's so many, all the brands are same. So any electric toothbrush would do, but it's actually the brushing technique that you have to consider.
Okay. So you recommend the electric one where we can know the pressure, how much we are putting. So that really gave a good clarification. And actually, even I didn't know that, so we all were using the manual one. So I think now it's time up to change to the electric. So next question. Tips can be important in life to maintain good relations and follow positive ways. So if you could, Dr. Hirudi, can you please give us some tips and important points we can remember to maintain a good oral hygiene?
Yes, so the first thing is eating healthy food, right? That is actually important for your teeth also, not just your nutrition, but it is important for your teeth to be strong. So oral bacteria feeds on sugar and refined carbohydrates to produce acid that attacks the tooth enamel. So sugar is the big villain here. The longer and more frequently their teeth are exposed to sugar, the greater risk of cavities. For example, sticky sugar, foods such as caramel, toffees, gums, or dried fruit. So when it stays in their mouth for hours, that could do serious damage. In addition, do not allow your child to have any sugar-containing liquid in that in the sippy cup for prolonged period, because you're sipping on it for a long time. So there's so much time for the bacteria to develop and cause cavity. The second point I want to address is brush twice a day with the correct technique. Now, I told before about the technique. When you're using a normal toothbrush, we use the scrub brush method. That means you're brushing it like this. So that method is wrong, because that is the way that that's going to cause gum recession. What you have to do is use the brush in a 45-degree angle and do it in circular motion. So before I mentioned that electric toothbrush is better. So this is why, because electric toothbrush goes in a circle anyway, so it is easier. And you don't apply a lot of pressure. But if you're using a manual, you will apply a lot of pressure and just brush. But that electric toothbrush will have a control. So that is why I mentioned before that you should use that. But if you don't have that, if you are able to control your hand pressure, then a normal toothbrush is fine. But just do it in circle motion. And next thing is make sure to spit out after brushing, but don't rinse. You should not rinse, because what's the point of rinsing if you are brushing your teeth with fluoride? Now, a lot of people think that, we have to brush our teeth and quickly rinse our mouth. But you have to wait at least 20 minutes before rinsing, because the fluoride takes time. It takes time to work. It takes about 20 to 30 minutes. So give at least 20 minutes and then you can rinse. But as soon as you brush, you just spit out the remaining toothpaste and let it be. So that's why we say you have to wait 20 to 30 minutes before eating or drinking. After brushing, you have to allow the fluoride in the toothpaste to have maximum contact with your teeth, which can enhance its effectiveness in preventing tooth decay. So that is very important. And always make sure you clean your tongue. Some kids don't like to clean their tongue. So when your tongue is not clean, you still have bacteria, and that can spread onto your teeth and create cavities too. So oral hygiene means it's the full mouth, not just the teeth. You have to brush your tongue. And also another thing is flossing. Flossing, of course, you don't have to do it every day. If you can do at least once a day, that's good. It's like flossing, it's like a string. You put it in between the teeth and just drag it back and forth and pull it out. So that you can clean the inside between the teeth, because from the toothbrush we can't clean. So with the floss, we can take it out. So make sure you do it gently, because sometimes there'll be bleeding. But it's recommended for children also to do it at least once a day. Then don't brush your teeth soon after eating sweets. Now there's a habit, sometimes we say, oh, as soon as we eat sweets, we have to go and brush our teeth, then all the bacteria will go away. That myth is there. But actually, the tooth is in acidic state. As soon as you have sweets, it's in an acidic state. So it can wear off the enamel if we brush as soon as we eat. So always make sure that you wait for an hour before brushing your teeth. Replace your toothbrush often. That I think a lot of parents don't do, because they think that is not necessary, but actually it is necessary. It should be replaced every 3 months, because if you want effective brushing, you need to have a good brush. And the last is go for routine checkups at least every 6 months, because as I said, early detection is much better for you and for us too, because there's no complication later on. So that's about it with the important points that you should remember.
So indeed, all these were important, plus golden tips, Dr. Hirudi. And we should all follow this to maintain our oral hygiene. So thank you very much, Dr. Hirudi, for joining this talk series. I thank you once again for scooping out time from your hectic schedule and sharing your expertise knowledge on oral hygiene and the importance of maintaining it. Hope this awareness on dental hygiene bring a positive change and the society benefit from it. So now we have come to the end of the interview session. But let me remind you all again about the international conference, which is going to be held on the 20th to 24th, 2024 in Mumbai, India. See you, Dr. Hirudi, in Mumbai. Thank you, everyone, once again. So it's a bye from me, your talk show host of IAQE. Signs off. We'll meet you up soon with another topic. Take care. Goodbye.
Thank you, Ms. Sir. Thank you for giving this opportunity. It was lovely to seeing you and having a discussion on person to person. See you in India. Thank you.
Take care.